back to your question, whenever we first see a stroke in a hospital, so let's say that you had a weakness on a scale of 1 to 10. Let's say on a scale of 1 to 10, the weakness is 5. We never tell the family or the victim of the stroke or the patient, we never tell them this is what they're going to be like for the next several weeks or months or stuff like that. So we tell them that the brain, even when the brain is damaged, it will very, very quickly start to look for blood vessels around the area that's damaged to regenerate some blood vessels and to borrow blood from these areas. So usually that takes about 2 or 3 weeks to regenerate some blood vessels and to go to the right place. So I never, when I look at a stroke, I keep on saying to the family or to the patient that don't count on it staying that bad or don't that weak or losing speech for that long. Within 2 to 3 weeks, his time, usually function comes back partially. What used to be 5 out of 10 weakness may become 2 or 3 out of 10 weakness. So don't make a judgment immediately. Mm-hmm. Now, after 2 or 3 weeks of time passes, then you're gonna be left with what you're gonna be left with, maybe small improvement over time. Mm-hmm. But let's say after a month or 6 weeks, you're probably gonna be left with what you're gonna be left with for a long time to come, essentially. Mm-hmm. And this is what you mentioned about the machine that we work with. It's mm-hmm. called magnetic stimulation of the brain, or transcranial, means through the skull, transcranial magnetic stimulation. Mm-hmm. And this is a rather new technology that actually deals with recovery and rehabilitation in a much different way than with new blood formation of new blood vessels. And here's how it works. You can improve function in the brain, and until we developed this technology, until that technology was developed, we did not know that. But there's 2 things that can aid recovery. One is supplying new blood vessels that send blood and oxygen to the damaged area of the brain, or by creating new synapses. That means the connection between brain cells, between each other, essentially, by creating new synapses that then go to the area of the brain that's damaged and recover function. And here's where I'm going with this. So basically, if you stimulate the brain with magnetic stimulation using a coil, right? So it's a completely outpatient procedure. You put a coil over the head and you stimulate the brain with magnetic impulses, not with electricity, with magnetic impulses. That's why you don't feel it very much. Mm-hmm. So basically the brain, something that happens in the brain is called neuromodulation. Modulation means changing of structure. Mm-hmm. So new synapses begin to develop, and then they go to that area of the brain that was damaged and regenerate some of these synapses. And the reason we know that this works is because we've had patients who 6 months after the stroke and were not improving anymore, you start giving them TMS, transcranial magnetic stimulation. And there's, they might be like this, let's say, and then you start giving them TMS over time, they might become like this. Now, the difference between this and this, I'm not going to tell you what the difference is, but you can imagine if you're here, you can't feed yourself. But if you get here, you can feed yourself. That's a huge difference in terms of recovery, So, so this is a new technology that's not FDA approved, by the way, in the States, but it's approved in other countries, like in China, where they do it. In fact, in China, patients or families take the machine to their home, and it's supposed to be operated by a doctor. But I heard that in China, some families buy the machine and take it home. We cannot do it in the US. I want to be very clear. And they are taught how to do it, and they experience some recovery. So there's a future in this area, is all I'm trying to say.
Yeah. Wow. So your technology is helping the major depressive disorder people
Yes.
who are massively depressed, and also in the future, in the stroke recovery as well.
Exactly.
Yeah,
Yeah,
that's
that's a great
great.
point. Yeah.
That's wonderful.